means 3 women here today will have their uteruses removed before the age of 60. Hysterectomy, the removal of the uterus, is the second most commonly done female operation after C-section. In the USA alone, 600,000 hysterectomies are done every year. Compare that to 300,000 appendectomies done for both genders combined. Yes, you heard me right. That's double the number of uteruses removed than appendices. In Hong Kong, it's 4,000 to 6,000 hysterectomies done annually. Of all those surgeries, only about 10% are done for the treatment of cancer. The rest are for fibroids, pelvic pain, heavy bleeding, or sagging uterus. And for women in their 40s who have hysterectomies, almost half of them will also have their ovaries removed at the same time, putting them into early menopause. Imagine if I just said that a third of the men here today will have their male reproductive organs removed before retirement age. I'm a medical doctor, not a surgeon, but a psychiatrist who studies the mind. So how did a mental health professional become interested in all these lady parts? This journey started when patients came to see me with symptoms of depression and anxiety not long after they've had female-specific surgeries. One woman had her uterus removed during childbirth because of excessive blood loss and could no longer give her child a sibling. Another had surgical thinning of her cervix for precancerous cells and was told she may not be able to carry a pregnancy to full term. Another young woman had her ovaries removed for painful cysts, which put her into early menopause. I diagnosed these women with depressive disorders and anxiety disorders and gave them the appropriate treatment, including medication. I thought these surgeries are so common. Of course, some women are bound to have difficulties adjusting afterwards. Things changed when I became one of those women. Exactly 2 years ago yesterday, I found myself sitting opposite my gynecologist with gripping pain in my abdomen. She said that my right fallopian tube, normally the size of my pinky, is now a pus-filled sac the size of my fist. If the abscess ruptures, I could die from a serious infection. She suggested we do keyhole surgery, where 3 small cuts into my abdomen would allow surgical instruments to enter and remove this ticking time bomb with a minimally invasive technique. As doctor to doctor, we discussed the technical aspects of the surgery, the risks of complications, and the recovery plan. 6 hours later, I was out cold on the operating table, where she performed surgery to save my life. The next morning, the doctor checked in on me and said the surgery went very well and I was ready to go home. I even did an online webinar and some Zoom meetings from my hospital bed. I thought to myself, modern-day medicine is amazing. I'm already back at work. But the following day, when the heavy injectable painkillers wore off, I found myself overwhelmed with pain, not just in my abdomen, but it was also in my chest and back. I couldn't engage my core at all, so I flailed helplessly in bed, unable to get up. And the regular painkillers the doctor gave me didn't work for that weird sensation of my gut popping out of my belly button, where one of the incisions were, every time I coughed or strained. And most importantly, I could not poop. So what did I do? I asked Dr. Google for help. But instead of comforting answers, reassuring me that I was going to be okay, Google came back with big scary words like paralytic ileus, umbilical hernia, intestinal perforation, and I spiraled, feeling utterly out of touch with my body. A few days later, at the follow-up appointment, the doctor removed the stitches from my incisions and told me the scars would heal beautifully. Weeks go by, and I'm already back at work and doing my sports. Yet I felt this incredible sadness coming from nowhere. It wasn't until an auntie shared with me her personal experience of having her reproductive organs removed that I put two and two together. It wasn't just the removal of a diseased body part, but it was an organ that represented part of my womanhood. The only way I can describe to you my grief and indignation at this loss is to tell you that I imagined myself in that operating theater, as I had done many times as a medical student, watching this useless, unwanted body part being unceremoniously dumped into a biohazard waste bag and incinerated. And it felt so wrong. I was mad at myself. How did I not see this coming as a psychiatrist? Why was this not part of my medical training? I thought back to those women I had diagnosed with depression and anxiety and realized they were actually suffering from a form of medical trauma, where events such as new diagnosis, subsequent medical intervention, recovery, and possible disabilities can trigger symptoms of post-traumatic stress. What's even worse is when patients' concerns are dismissed or invalidated, being told there's nothing physically wrong with them, that it's all in their head. So go see the psychiatrist. This is medical gaslighting. But unlike the popular term gaslighting, meaning a deliberate manipulation to distort someone else's sense of reality, medical gaslighting can often occur unintentionally, either because there are no straightforward answers for the patient's symptoms, no visible problems from the tests or scans, the highly variable symptoms of medical trauma that patients present with, or that medical practitioners have their subconscious bias and that their training simply taught them to put their emotions aside so they can get the job done effectively. Medical gaslighting can have profound consequences, such as delayed or misdiagnosis and incorrect treatment, a loss of trust in the medical system, a deep sense of frustration and helplessness from the patients, leading to more medical trauma. So this got me thinking, what's so different about female-specific surgeries as opposed to other kinds of surgery? First of all, I think it's because women's organs are inside our abdomen, and we don't see it when they're removed. And this invisibility makes it harder for us to relate to that loss, not just in the physical sense, like an arm or a leg, but in the sense of that female identity. Secondly, female organs have a more negative connotation in our culture, which can make it harder for women to talk about. We say things like, she's a bit hysterical, using the Greek word hystera, meaning the uterus, as opposed to saying, he's got balls. And finally, perhaps women do have a biological expiry date for having children. And when we're in our 40s and 50s, we're told that we don't need them anymore, so it's best that they're removed. I slowly healed by taking the time to do things that made me feel feminine and soft again. I spoke to other women and was surprised how open they were to sharing their experiences, with many admitting they had never thought or spoken about it before. So I'm here today to tell you, as a doctor and as a patient, don't let anyone tell you that your bits are not needed, even if it's a medically necessary procedure. And let's treat this topic with dignity and respect. Be aware of the emotional and psychological trauma beyond the physical scars, and that it's normal to experience these reactions. Advocate for yourself to be heard, and have a trusted friend come with you to the doctor's appointment when you have these difficult conversations. And if you're a medical professional yourself, add a bit of human touch to your art of healing, and let us be mindful of the way we communicate and interact with our patients. All the women here today will go through some form of female procedure, from pap smears to mammograms, from childbirth to organ removal. So be prepared when this happens to you, and together we can heal in a holistic way with modern-day medicine.
Thank you.